Adaptive development refers to the practical, everyday skills children use to participate in daily life. In infancy and toddlerhood, these skills include feeding, drinking, sleeping routines, early dressing, hygiene participation, and growing independence during daily activities. These abilities develop gradually and are closely connected to motor, sensory, communication, and social emotional development. When children gain adaptive skills, they become more active participants in their routines and relationships. It's important to be aware of adaptive development because many opportunities to support the development happen during normal routines and flow of the day. Meal times, diapering, hand washing, transitions, toileting, and rest routines all provide natural teaching moments. This session focuses on what adaptive development looks like from birth to age 3, and also how to support children who may need extra help or intervention. We know that independence grows through responsive relationships, not pressure. Supporting adaptive development means noticing what a child can do, building on those strengths, and partnering closely with families and other service providers. This session is enabling us to have a stronger understanding of adaptive development in infants and toddlers. We will discuss and define adaptive skills and look at why they are so important in our early childhood education settings. We will review common developmental milestones related to feeding, dressing, hygiene, regulation, and daily routines. We will also discuss practical strategies that teachers can use to support adaptive growth in classroom routines. Another objective is to recognize possible warning signs when a child may need additional support due to a developmental delay. We will learn how adaptive delays may be connected to motor, sensory, communication, or regulation challenges. We will also examine the role of the occupational therapist in early intervention and how OTs support participation and development in everyday life. Another goal is to help teachers understand how to embed support into daily routines instead of treating adaptive development as a separate activity. We will also explore how to write and understand SMART IFSP goals related to adaptive skills. It's also emphasized that the importance of family connections and partnerships are critical so that we can have meaningful, respectful relationships between classrooms and home settings. Adaptive skills are the self-help and daily living abilities children use to meet their needs and participate in everyday routines. For infants and toddlers, these skills are emerging and often begin with participation before full independence. An infant may begin by opening their mouth for a spoon, holding a bottle with support, or calming with predictable sleep routines. A toddler may begin helping push an arm through their sleeve, use fingers to pick up food, drink from a cup, or assist with hand washing. These are adaptive skills because they allow the child to function more independently in daily life. Adaptive development is not just about doing tasks alone. It is also about learning routines, anticipating what comes next, tolerating sensory experiences, and communicating needs during care activities. These skills are deeply tied to a child's quality of life and access to learning. When adaptive skills are delayed, children may struggle with participation at home, in their classroom, and in any other community settings. Early childhood educators play an important role because they see children in routines where adaptive skills naturally occur. By understanding adaptive development, teachers can create environments that encourage independence while honoring each child's developmental pace and individual needs. Adaptive development is important because it helps children participate more fully in the world around them. When children learn to feed themselves, assist with dressing, or communicate a self-care need, they experience a sense of autonomy. These skills support confidence because children begin to realize that their actions have purpose and effect. Adaptive skills also make routines smoother for teachers and families. A child who can participate in a mealtime or a transition routine is often more engaged and less frustrated. These abilities also support later school readiness because independence in daily routines helps children function in group settings. Adaptive development can reduce stress for families when children are able to participate more successfully in at-home care routines. It also supports inclusion because children with stronger adaptive participation can access more experiences in classrooms and in the community. Small steps in independence often have a big impact on how capable a child feels. Adaptive development is not about pushing children to do things before they are ready. It is about building meaningful participation over time through repetition, support, and responsive teaching. Adaptive development does not occur in isolation from other developmental areas. A child's motor skills affect whether they can grasp a spoon, sit for feeding, reach for clothing, or hold a cup. Sensory processing affects how they respond to textures, temperatures, noise, movement, and touch. Communication skills influence how children express hunger, discomfort, preferences, or the need for help. Social emotional development shapes how children tolerate routines, trust caregivers, and persist with new self-help tasks. Cognitive development also matters because children must remember routine steps, anticipate events, and understand cause and effect. For example, hand washing involves motor planning, sensory tolerance, imitation, language, and routine understanding. When a child struggles with adaptive skills, the underlying challenge may involve several developmental systems at once. This is one reason why observation is critical. Teachers should not assume that a child is simply refusing or being uncooperative during routines. Instead, this behavior may reflect a behavioral, sensory, communication, or motor need. Looking at adaptive development through a whole child lens leads to more supportive and effective interaction. There are several important principles that guide how teachers support adaptive development in infants and toddlers. First, adaptive learning happens best within secure and responsive relationships. Children are more willing to try new self-help tasks when they feel safe, understood, and supported. Second, natural routines are the best context for teaching adaptive skills. Rather than isolating skills, teachers can embed support into meals, diapering, toileting, hand washing, dressing, and cleanup. Third, children need repetition and consistent opportunities to practice skills. Adaptive development grows through many small attempts across time, not through one lesson. Fourth, teachers should use responsive support by offering help that matches the child's current ability level. This means not doing too much for the child, but also not expecting too much too soon. Fifth, a strength-based approach focuses on what the child can already do and the next small step forward. Progress may be gradual, especially for children with developmental delays or disabilities. Celebrating participation is just as important as celebrating independence. When early childhood educators use these principles, adaptive skill support becomes respectful, effective, and family-centered. In the first 6 months of life, adaptive development centers on regulation, feeding, and participation in caregiving routines. Infants begin developing coordinated sucking, swallowing, and breathing during feeding. They show hunger cues such as rooting, sucking on hands, or fussing, and they show fullness by turning away or slowing down. These cues are part of adaptive functioning because they help the infant communicate needs. Young infants also begin adjusting to daily rhythms related to sleeping, feeding, and soothing. During diapering, bathing, and dressing, they begin to tolerate touch, movement, and handling with caregiver support. Some infants begin showing anticipation during familiar routines, such as calming when a bottle is prepared or becoming more alert before feeding. These early responses form the foundation for later independence. At this age, the goal is not self-help independence, but growing participation and regulation within routines. Teachers should watch for how infants respond to routine caregiving and whether they can organize themselves enough to participate. Adaptive development in early infancy is about building trust, predictability, and successful co-regulation with caregivers. Between 6 and 12 months, adaptive skills become more active and visible. Many infants begin opening their mouth for a spoon and showing interest in self-feeding. As hand skills improve, they may start finger feeding small foods. Some infants begin holding a bottle independently for part of a feeding or helping hold a cup with support. They may also show stronger anticipation during routines, such as reaching toward a bib before meals or calming when a sleep routine begins. During dressing, infants may extend an arm or leg or tolerate the sequence more predictably. They also begin showing preferences related to food, routines, and familiar caregivers. Around this time, children often become more aware of their environment, which can affect their participation in daily routines. They may become distracted during feeding or resist parts of care routines if they are tired or overstimulated. Early childhood educators can support this stage by using consistent routines and allowing infants chances to participate actively. The important focus is helping infants move from passive caregiving to shared participation in daily activities. From 12 to 18 months, toddlers typically show significant growth in adaptive skills. Many can finger feed independently and enjoy practicing with a spoon, even if there is still spilling. They may drink from a cup with assistance or begin using a straw cup more consistently. During dressing, toddlers may lift arms, push feet through pants, or remove simple items like their socks. They also begin to understand familiar sequences such as snack time, diapering, and cleanup. At this stage, participation often increases before accuracy does. A toddler may insist on doing a task, but still need considerable support to complete the task. This desire for independence is developmentally appropriate and should be supported. Toddlers may also begin noticing toileting routines, showing discomfort with a soiled diaper, or communicating elimination needs in simple ways. Teachers can provide time, simple language, and supportive routines to encourage toileting participation. The goal is not perfection, but growing involvement and confidence in everyday self-help tasks. Between 18 and 24 months, adaptive development often becomes more intentional and routine-based. Toddlers are usually more successful with spoon use and may begin using a fork for soft foods with support. They may drink from an open cup with assistance, though spilling is still common. In dressing routines, they often help undress by pulling off socks, shoes, or any simple clothing items. They can participate more actively in hand washing by putting their hands under water, rubbing their hands together, or reaching for a paper towel. Many toddlers also begin showing signs of toileting readiness at a more consistent level. They may notice when they're wet. They also may be staying dry for longer periods of time or showing interest in the toilet. Communication growth also helps adaptive development because children can better express wants, dislikes, and their needs. This age can also bring strong opinions and resistance, which is part of typical toddler development. Teachers should understand that refusal is not always defiance. It may reflect a desire for more control, more choices, sensory discomfort, or a need for more support during a routine. Structured choices and consistent, predictable routines can help toddlers participate more successfully. From 24 to 36 months, toddlers continue building independence and adaptive skills. Many can feed themselves with increasing control using a spoon and sometimes a fork. They may drink from an open cup with fewer spills and begin managing simple containers with help. During dressing routines, they might still continue to remove easy clothing items, but may have moved on to pulling their pants up or down and doing more complicated dressing tasks. They also may become more actively involved with toileting readiness, although it should never be forced. Toddlers also become better at understanding expectations and transitioning. At this age, adaptive growth is influenced by their opportunities for practice and adult expectations and support. Some toddlers are highly motivated to be independent, while others still need more time. Teachers should balance encouragement with patience. Toddlers still need scaffolding, visual supports, and repeated opportunities for practice. Independence develops through all of these things. The supported opportunities are most important. We are not working through pressure or comparison to other children's developmental levels. Feeding is one of the earliest and most important areas of adaptive development. It begins with successful feeding patterns in infancy and gradually expands into self-feeding and mealtime participation. During infancy, Adaptive feeding includes showing hunger cues, coordinating suck and swallow, and calming during feeding routines. As infants grow, they begin opening their mouth for a spoon, reaching for food, and assisting with holding bottles or cups. Finger feeding is a major milestone because it requires hand control, visual attention, motor planning, and motivation. Later, toddlers practice using spoons, forks, straws, and open cups. Feeding development also includes toddlers staying seated for meals, tolerating different textures of food, and participating in a mealtime routine, such as cleaning up afterwards. You can support feeding development by creating calm environments and always allowing time for practice and scaffolding skills. Some feeding difficulties may be motor-based, sensory-based, medical, or behavioral. Because feeding is such a complex adaptive area, careful observation and collaboration with families and specialists is important. Dressing, diapering, toileting, and hygiene participation are also essential daily living skills for infants and toddlers. In infancy, participation may look like relaxing during diapering, tolerating wiping, or moving with caregiver support. As infants grow, they begin lifting arms, pushing legs through clothes, and help taking simple items off and on. These actions show increasing awareness of routines and body movement. Hand washing, face wiping, nose wiping, and toothbrushing participation can also become more important and over time. Even when children are not independent, they can be active participants. These routines support body awareness, predictability, sensory tolerance, and communication development. Early childhood educators can help narrating what is happening, using the same steps and sequence each time, and giving children simple jobs during the routine. Adaptive participation in care routines also supports dignity and relationship building. When adults slow down and invite participation, children learn that care routines are not something done to them, but something they can be part of. Sleep and rest routines are also part of adaptive development because they involve self-regulation, participation, and growing autonomy and independence. Young infants rely heavily on adults for co-regulation, but over time they begin developing patterns that help them settle and rest. Predictable sleep routines support adaptive functioning because children learn what to expect and how to transition into rest. Some infants use self-soothing strategies such as sucking fingers, holding a comfort item, or responding to calming sensory input. In group care, rest routines can be especially challenging because of noise, transitions, and individual differences in sensory needs. Teachers can support adaptive development by creating consistent rest cues and a calming environment. Children who struggle with regulation may also struggle with feeding and transitions and any hygiene routines. This is why adaptive development should include attention to sleep and calming skills. Teachers must respect family routines and cultural practices related to sleep. Supporting rest participation is not simply behavior management. It is part of helping children build functional regulation in daily life. The most effective way to promote adaptive development is to embed support into daily routines. We know that young children learn best when practice happens in meaningful, repeated contexts rather than isolated drills. For example, teachers can support spoon use during meals, hand washing before snack, and dressing participation during outdoor transitions. Repetition is critical because, as we know, adaptive skills take time to develop. Children have to have many opportunities of the same actions across days and weeks to increase independence in developing these skills. Teachers should also give children enough time to respond before stepping in too quickly. Waiting a few extra seconds can allow a toddler to attempt part of the task independently. Guided practice is also important, especially when new skills are just emerging. Teachers can model, assist, and gradually fade support as the child becomes more capable. These predictable routines and skills help children understand expectations and reduces frustration. Children can focus more on participating and less on figuring out what comes next. Daily routines are not interruptions in learning. They are one of the most powerful contexts for adaptive skill development, along with all areas of development. Scaffolding means providing the right amount of support to help a child succeed with a task they cannot yet do independently. In adaptive development, scaffolding is especially important because daily living tasks often involve multiple small steps. Early childhood educators can begin by breaking a routine into manageable parts. A child may not put on a coat independently, but they may hold out an arm, zip with help, or carry their coat to their cubby. Using least to most support encourages independence while still ensuring success. This means starting with a cue, a gesture, or a model before moving to more direct physical assistance. Modeling and imitation are powerful because infants and toddlers learn so much by watching others. As children's skills improve, adults should gradually fade assistance rather than to continue doing the task for the child. Celebrating effort is so important. A child who attempts to scoop food, even with spills, is making meaningful progress. Scaffolding helps children experience success without unnecessary frustration. When adults use this approach consistently, children can develop the skill and confidence across daily routines. The environment can either support or interfere with adaptive development. When materials are accessible and routines are organized, children have more chances to participate independently. Child-sized cups, spoons, chairs, and sinks make self-help tasks more manageable. Predictable room arrangement also supports adaptive routines because children begin knowing where to go and what to expect. For example, having consistent places for bibs, wipes, cups, and coats helps infants and toddlers participate in the routine. Supportive seating and positioning are also especially important during feeding. A child who is not well positioned may struggle more with self-feeding, swallowing, and attention. Early childhood educators should also look for unnecessary barriers, such as hard to open containers, materials stored out of reach, or routines and a schedule that moves too quickly. Visual order and accessible tools encourage children to act independently. Environmental support is particularly important for children with any developmental delays or sensory and motor challenges. Often, a small change in the setup of an environment can lead to a major improvement in participation. Thoughtful environments help adaptive skill learning happen more naturally and successfully. Communication plays a major role in adaptive development because children need ways to understand routines and express their needs and wants. Teachers can support adaptive skills by labeling their actions during daily routines. Simple language such as wash hands, sit down, more drink, or push arm in helps children connect words to actions. Offering simple choices can also increase participation because toddlers often respond better when they have some control. For example, a teacher might ask, "Would you like the blue cup or green cup?" Or, "Do you want to wash hands first or get your bib first?" Gestures and visual supports can help children who are not yet using many words. Communication support also includes teaching children how to request help. When children understand the sequence of a routine, they may most likely be more cooperative and engaged. Adults can narrate the order of the events and repeat key phrases consistently, which adds to that sense of predictability. Communication is not separate from adaptive learning. It is one of the tools that makes adaptive routines more understandable, predictable, and successful for infants and toddlers. Sensory processing has a strong influence on adaptive development. Some children are highly sensitive to textures, smells, sounds, movement, or touch. A child may avoid messy foods, resist toothbrushing, cry during dressing, or become upset during diapering or toileting because of sensory discomfort. Another child may seek extra movement or deep pressure and have difficulty settling for meals or rest. Teachers should consider whether a child's difficulty with an adaptive task may be related to sensory processing rather than behavior alone. Observing patterns is critical. You might ask, does the child resist certain textures, clothing materials, temperatures, or sounds? Sensory supports could include gradual exposure, predictable touch with a verbal reminder, calmer environments, supportive seating, or alternative foods when appropriate. Working with specialists can also help teachers and families understand sensory needs more clearly. Sensory responsive teaching does not mean avoiding all discomfort forever. It means helping children participate in routines in a way that is supportive and developmentally appropriate. When sensory needs are understood, adaptive routines often become more successful and less stressful for everyone. And over time, children's tolerance can increase. It is important for early childhood educators to recognize when a child may be showing signs of adaptive developmental delay. Red flags may include persistent difficulty with feeding, such as trouble coordinating eating, extreme selective eating, or the inability to progress with those typical expected participation levels. An infant or toddler may also show very limited interest in progress in self-help tasks like cup drinking, utensil use, dressing, or hygiene. Some children remain highly dependent in daily activities beyond what would be expected for their age, even when they have had regular opportunities over time to practice. Other children may avoid routines because of motor difficulty, sensory distress, or communication challenges. Frequent frustration, gagging, refusal, or intense distress during everyday care tasks could signal a concern. Early childhood educators cannot make diagnosis, but they can document what is observed. Patterns over time are especially important. We're not going to necessarily compare the child to peers. We are considering developmental expectations and the child's overall functioning. When concerns are present, collaboration with families and early intervention professionals is essential. We know that early identification and support can improve outcomes and reduce stress for children and families. While every child develops at their own pace, some patterns may suggest a need for closer monitoring or referral. In early infancy, red flags may include significant feeding difficulty, a poor coordination of sucking and swallowing, or unusual trouble calming during any type of care routines. By the later infant period, a child who shows no interest in finger feeding, does not open their mouth for a spoon, or has difficulty with feeding progression may need further evaluation. In toddlerhood, persistent inability to participate in dressing, hand washing, cup and utensil use may be a cause for concern. A child who consistently seems unaware of routines or completely unable to tolerate care experiences may also need additional support. Strong distress, choking, gagging, selective eating, all of those things can warrant a need for extra support. It's important to consider the whole picture, the whole child development, including motor, sensory, communication, and any medical factors. We always want our documentation to be objective and specific. Many programs will use specific observational and assessment tools, such as an ASQ3, the Brigance, or even Teaching Strategies Gold. When early childhood educators share concerns with families, it must be done respectfully and collaboratively. The goal is to support the child early, but not to label the child prematurely. When teachers notice possible adaptive delay, as mentioned, our first step is careful observation and documentation. For example, it is more useful to write that a child gags when offered textured food or cries during hand washing than to say the child does not like routines. Objective documentation helps families and specialists understand the concern more clearly. Teachers must also note the context in which the challenges are occurring. How often is this happening, and are there any supports that are helping? When concerns are shared with families, we should always begin with strengths as well as our concerns. Our conversation should be respectful, specific, and free from blame or alluding to a diagnosis. It's important to ask families what they see at home. Do they see similar patterns? Or could there be relevant medical or developmental histories that the teachers are unaware of? If concerns continue, the child may need referral to their medical provider, to early intervention systems, or some other appropriate service system. Teachers should, of course, follow program procedures and the local referral processes. Families must contact early intervention in Kentucky. KEYS, Kentucky Early Intervention Systems, cannot provide services unless a family makes contact and accepts the process of evaluation. Early childhood educators and programs can advocate and support families through this process. It's important to remind and reinforce with families that early action can affect increased success of outcomes and that adaptive skills affect so many parts of daily life. The occupational therapist, or OT, plays an important role in early intervention for infants and toddlers with adaptive needs. In early intervention, the OT focuses on helping the child participate more successfully in everyday routines and activities. These might include all of the routines we've mentioned: feeding, dressing, hygiene, play, positioning, and sensory regulation. Occupational therapists look at the whole task, the child's current skills, and the environment to understand what is supporting and what could be interfering. They may address fine motor development, motor planning, sensory processing, seating and positioning, feeding, and any other early self-help skill. In many cases, the OT is involved in feeding support when sensory and motor issues affect mealtime participation. A key part of the OT role is coaching teachers and families rather than only working directly with the child in isolation. This means OTs help teachers and families learn and use strategies that increase adaptive skill development during the child's real daily routines in the classroom and in the home. OTs often work in the natural environments. So the classroom, the child's home, the park, a playground, wherever the child experiences daily life and needs to build skills. The OT's recommendations are meant to fit into everyday life, not become separate therapy tasks. Collaboration between teachers, families, and the OT can significantly improve adaptive participation and overall outcomes. Teachers are valuable partners when a child is working with an occupational therapist because teachers see children during group routines, meals, transitions, and care activities. They often notice patterns that others may miss or do not have the opportunity to observe. Sharing clear observations with the occupational therapist helps create a more complete understanding of the child's skills and needs. Teachers can ask the occupational therapist specific questions about how to support routines around feeding, hand washing, dressing, toileting, or sensory regulation. Once strategies are recommended by the occupational therapist, consistency matters. Using the similar supports in the classroom and at home can help children learn more effectively and reduce confusion. Teachers can also embed occupational therapy recommended strategies into the normal classroom routines, not treat them as separate therapy activities. This could include seating changes, adapted utensils, sensory supports, visual cues, or step-by-step prompting. Progress monitoring should be ongoing and practical. Teachers can note what is working when a child is more successful and what barriers remain. Collaboration is strongest when it is respectful and routine-based. When teachers, families, and occupational therapists work together, adaptive goals become more functional and meaningful for the child. Infants and toddlers and their families who are receiving early intervention services receive and follow a document called an Individualized Family Service Plan, commonly referred to as an IFSP. The IFSP is a legally binding document or agreement between the family and the early intervention system regarding services and outcomes. IFSP goals help ensure that adaptive outcomes are clear, functional, and family-centered. These goals must be SMART. SMART stands for specific, measurable, achievable, relevant, and time-bound. An adaptive IFSP goal should describe a meaningful skill the child will use in a real daily routine. It should not be vague or overly clinical. Instead of writing that a child will improve self-help skills, a stronger goal would describe exactly what the infant or toddler will do, in what context, and how progress will be measured. Goals should also be achievable based on the child's current developmental level and the supports that are available. Relevance matters because IFSP outcomes should connect to family priorities and their daily life. A goal related to mealtime, dressing, or hygiene participation is often highly meaningful to families. Time-bound goals help teams evaluate whether progress is occurring within a reasonable period. In the Kentucky Early Intervention System, outcomes are typically written for a 6-month time period. Early childhood educators can support SMART goals by providing information to the IFSP team about classroom routines and the realistic available daily opportunities for the child to practice the skills. Good adaptive IFSP goals should focus on participation, not perfection. They help everyone work toward the same functional outcome in ways that fit the child and family's everyday life. Families of infants and toddlers who qualify for early intervention services work with a team to develop an individualized family service plan. The IFSP is a legally required plan created jointly by the family and the early intervention team to outline the child's goals, services, and supports. IFSP goals are developed based on the family's priorities, concerns, and daily routines. For example, a family may share that becoming more independent during meals is an important priority for them. Because of that, the IFSP team would develop an adaptive goal related to self-feeding. IFSP goals should be SMART, meaning they are specific, measurable, achievable, relevant, and time-bound. An example of a SMART adaptive goal is within 6 months during snack and mealtime routines, at home and at childcare, Maya will independently self-feed at least 5 bites of soft food using her fingers or a spoon with no more than 2 verbal or gestural prompts in 4 out of 5 opportunities. In family-friendly language, this means that over the next 6 months, Maya will practice feeding herself during meals and snacks at home and at childcare. The goal is for her to eat at least 5 bites on her own using her fingers or a spoon with only a little help from an adult most of the time. That help could be a prompt such as, Maya, pick up your spoon. Or it could look like an adult pointing to the spoon to remind her what to do next. This goal is specific because it clearly identifies the skill and when it will happen. It is measurable because adults can count bites, prompts, and opportunities. It's achievable because it focuses on an important next step rather than complete independence. It's relevant because mealtime independence matters to both the family and the caregivers. It's time-bound because it is expected to be worked on over the next 6 months. This type of goal helps everyone support the same skill during the everyday meal routines. Teachers can encourage progress during meals by providing enough time, child-sized or adapted utensils, and consistent support. Families can do the same at home. A strong adaptive feeding goal makes practice meaningful, natural, and shared across settings. Another example of a SMART IFSP goal focused on dressing and hygiene participation could be, over the next 6 months during everyday routines like arrival, playing outside, and washing hands, Jaden will begin doing 2 parts of these routines independently. This might include things like putting his arms into sleeves, taking off his socks, putting his hands under the water, or drying his hands. We will look for Jaden to do this successfully most of the time over 2 weeks in a row. This goal is specific because it identifies the type of actions expected. It's measurable because adults can record how many steps Jaden completes and how often. It's achievable because the goal targets participation in 2 routine steps rather than full independence. It is relevant because dressing and hygiene happen every day in both home and classroom settings, and it is time-bound through the timeline and progress criterion. Teachers can easily embed practice into normal transitions without creating extra sessions. Families can work on similar steps during morning dressing or at bedtime routines. This kind of goal values functional participation and consistency. It helps everyone notice and celebrate meaningful growth in everyday independence. Strong family partnership is essential when supporting adaptive development in infants and toddlers. Families know the child's routines, preferences, challenges, and strengths in ways that are deeply valuable. Teachers should approach collaboration with curiosity and respect. Adaptive routines are closely tied to family culture, values, and schedules. Because of this, teachers should avoid making assumptions about what routines should look like at home. Instead, they should ask families what matters most to them and what they are noticing. Sharing observations should go both ways. Teachers can describe successful strategies from the classroom, and families can share what works at home. Practical strategies are often most helpful when they are simple and easy to embed. Family partnership also means recognizing stress and celebrating small gains. When adults across similar settings use similar language and support strategies, children often make stronger progress. Respectful family collaboration makes adaptive goals meaningful, consistent, and sustainable. We can put this whole process together by considering a toddler who becomes upset during meals, avoids touching many foods, and rarely participates in dressing or hand washing. The classroom teacher notices that the toddler turns away from spoons, cries when hands are messy, and stiffens during clothing changes. The family shares that similar struggles are happening at home, especially during dinner and bedtime dressing. Together, the early childhood education team with the family refers the child to early intervention, and an occupational therapist becomes involved. The occupational therapist observes routines in the natural environment and identifies sensory and motor factors that may be affecting the toddler's participation. The team then develops simple strategies such as supportive seating at meals, gradual exposure to different textures of foods, predictable routine language, and giving the child one dressing step to complete each day. A SMART IFSP goal is created around mealtime participation and hygiene routines. The teacher and the family both use the same language and strategies. Over time, the child begins tolerating more textures, helps with hand washing, and shows less distress during dressing. This is an example to show how observation, family partnership, and occupational therapy collaboration can improve adaptive functioning in meaningful daily routines. Adaptive development is a foundational part of infant and toddler growth. These skills include the everyday abilities children use to participate in feeding, dressing, hygiene, sleeping, and other daily routines. Children build adaptive skills through repeated opportunities in meaningful contexts. Participation often comes before full independence, and that progress should be valued. Classroom teachers can support adaptive development by embedding learning into daily routines, scaffolding carefully, and using responsive teaching practices. When children struggle significantly with adaptive tasks, early observation and collaboration are important. Developmental delays in adaptive functioning may be connected to motor, sensory, communication, or regulation needs. Occupational therapists play an important role in helping infants and toddlers participate more successfully in daily life. SMART IFSP goals help teams focus on practical, measurable, and meaningful outcomes. Most importantly, families are essential partners in all adaptive support efforts. When teachers, families, and early intervention specialists work together, infants and toddlers are better supported in building confidence, participation, and independence.